So welcome to scenario 9. In this scenario, you are reviewing a 6-month-old patient in November, and mum has been complaining that the child has been struggling with the breathing, sounds wheezy, and is feeding less than she normally would. When would you admit this patient to hospital? So there's a couple of pointers within this question that immediately point out to the diagnosis. You have a young baby presenting with respiratory symptoms in November, so it's more than likely to be something like bronchiolitis, right? But this is a really broad scenario, and this is much more typical of the AKT, where you may have 2 of the stems that might be appropriate. So you should definitely refer a child with bronchiolitis if they're having or reported to be having apneic episodes, if they appear significantly unwell, if they have marked respiratory distress. So a couple of things that you can use for this is the child grunting, is there significant recessions, or does the child have a respiratory rate of more than 70? And the final thing is the child cyanotic, or do they have extremely low SATs of less than 92%? Now, there's another couple scenarios where you should consider a referral. So, does a child have a respiratory rate of over 60? Is their oral intake reduced? So, is it reduced to 50 to 70% of their regular volume? Or is the child clinically dehydrated? Now, in addition to these, there are other scenarios where secondary care may be more appropriate. So let's just consider the child's comorbidities. So does the child have chronic lung disease? Do they have congenital cardiac disease? Do they have any neuromuscular disorders? Is the child immunodeficient? Now, all of those things may prompt you to refer for a secondary care assessment. If you have a child under the age of 12 weeks, again, a referral is more likely to be appropriate, especially if they're having marked respiratory distress. And then you've got premature babies. So if a child is premature, then naturally they're going to receive an injection to help them stay away from bronchiolitis. But you should still have a lower threshold for those patients. And although bronchiolitis can be a relatively easy thing to manage in the community, you should always consider parental factors when it comes to children. So what are the child's social circumstances like? Do the parents have the skill and the confidence to look after a child with bronchiolitis? And are the parents confident enough to spot the red flags should some red flags appear? And the other thing to consider, maybe not if you're living in a kind of built up town area, but if you're in a rural area, will they be able to get to a hospital if red flags are present? Now, thank you for listening to this podcast. I hope you've found it useful. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.